Hi everyone. Today in this video we are going to discuss about precautions and side effects of finasteride. What is this drug finasteride? This is one of synthetic steroid belonging to the category of 4-AGA steroids. So nitrogen is present at the fourth position of steroidal ring. And this drug is indicated for the treatment of BPH, benign prostatic hyperplasia, where the prostate enlargement results in the decreased urination resulting in the urinary retention as well as increased urinary frequency. In such conditions, finasteride can be given in order to reduce the action of testosterone and to reduce the size of the prostate gland. Similarly, this drug can also be indicated for the treatment of male pattern baldness. This drug can produce the hair growth, thereby it can be used for the treatment of alopecia, the loss of hair. So the male pattern baldness can be treated by finasteride. Today in this video we are going to see what are the important precautions of this drug, how they can be managed, what is the chemical nature and what are the side effects. All these things we will discuss in this video. So this is the structure of finasteride. We can observe the nitrogen is present at the fourth position of the steroidal ring. And this drug is going to inhibit the activity of testosterone. This testosterone is going to be metabolized to one of the active metabolite, dihydrotestosterone. And this step is mediated by one of the important enzyme 5-alpha reductase type 2. Even type 1 is present, but finasteride mainly acts on type 2 5-alpha reductase enzyme. This enzyme is present in various tissues such as prostate, liver, skin. Now finasteride can block this 5-alpha reductase enzyme, thereby it inhibits the activity resulting in the reduced formation of DHT. As the DHT is not formed, the activity of testosterone is going to be reduced, resulting in the decreased prostate size as well as reduced loss of hair. In this way, finasteride can be used for the treatment of BPH as well as male pattern baldness. But what are the precautions that should be considered with the use of finasteride? First of all, finasteride is not indicated for treatment of hair loss within the woman. This drug is only intended for male pattern baldness. It is not useful in the woman. And this drug is also not indicated for the children. So for pediatric purpose, this drug should not be used. Second important precaution is the supply of finasteride. This drug is available as a tablet which is having an outer coat. This outer coat prevents the contact of finasteride while handling. So handling of finasteride is very important. If it is improperly handled, resulting in the breaking of the tablet or crush of the tablet, this may result in the release of the active ingredients from the tablet. If these are accidentally contacted with any pregnant woman, it may produce a fetal damage. Accidental consumption of finasteride can produce male fetal damage. That's why pregnant women should not handle any crushed or broken tablets. Similarly, finasteride when contact with the hands, it can be absorbed and again it can produce fetal damage. That's why the broken tablet should not be handled with the pregnant woman or women liable to pregnant within few months. And any contact area should be thoroughly washed with soap water in order to reduce the fetal damage. Similarly, another important precaution of finasteride is that this drug is extensively metabolized and converted into metabolites by liver enzymes. So cytochrome P450 enzymes are involved in extensive metabolism of finasteride within the liver. These metabolites are somewhat less active and comparatively they are less than 20% active than finasteride. So by metabolism, the activity of finasteride is going to be reduced. But in the patients with any liver failure, this metabolism is not properly maintained, resulting in the increased toxic effects of finasteride. So the patients with liver failure, this drug should be carefully given. Similarly, this drug can produce some breast enlargement within the men and it can produce some lumps, pain, even nipple discharge. So if any of these symptoms are observed, then caution should be taken as this drug can produce some gynecomastia within the patients. As finasteride is indicated for BPH, this drug can increase the risk of prostate cancer. Normally, finasteride inhibits the levels of PSA, prostate specific antigen. But in the patients with any prostate cancer, we can observe increased levels of PSA. In such patients, finasteride can further increase the risk of prostate cancer. Now what is the side effects of this drug? So the important side effects are mainly related with hormonal activity. It can produce some erectile dysfunction, loss of libido, and decreased ejaculation and ejaculatory volume. Some testicular pain can also be observed. It can also increase the breast enlargement, breast tenderness. Some hypersensitive reactions such as swelling of lips and face can be observed. It can also produce some urticaria, skin rashes, and finally this drug can also increase the risk of prostate cancer within the men. So these are the important precautions and side effects of finasteride, which is used for the management of BPH as well as for the treatment of male pattern baldness. So when this drug is indicated for any of these purposes, caution should be taken to check any symptoms of gynecomastia or development of prostate cancer, and the drug should be handled very carefully. Any contact of damaged tablets by pregnant women may result in fetal damage. So with these precautions, finasteride can be used for the management of BPH as well as male pattern baldness. So that's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.